All right, thanks for joining today. Today I'll be talking through the chemical buffer systems in the body against changes and also with increases and decreases in hydrogen ions. And I'm going to start with kind of a problems-based approach as the textbook laid it out. So first off, pH is the measurement of hydrogen ions, specifically within the body and its plasma. So in the fluid that's flowing through your blood vessels and capillaries right now, about half of your blood volume is plasma, as well as the extracellular fluid which surrounds the plasma, which eventually diffuses into your cells. Now, the narrow range that our body wants to be in for this area of our body in the plasma extracellular fluid is about 7.35 to 7.45. Now, if you remember probably from other classes, the water pH is exactly at 7, and it's on a 14-point scale, so 1 through 14. So we're slightly basic here within our blood and our plasma and our extracellular fluid. But the issue is that the body always, most of the time at least, produces acids with metabolism that dissociate into these hydrogen ions, which would lower the pH. So if we look at like carbonic acid, when we have cellular respiration, we use that glucose, break it down with oxygen, and then we get CO2, water, and energy. Well, these CO2 levels increase, making an acid. And also there's inorganic and organic acids. I didn't mention that with fat and protein metabolism. So fat would be more organic. Protein metabolism sometimes more inorganic. It's primarily nitrogen, as well as lactic acid from exercise. So in order to kind of buffer these high amounts of hydrogen ions in the bloodstream and in the extracellular fluid, the body has three main buffer systems, and I'll be talking through just one of them, which is the chemical buffer system. The other two will be the lungs and the renal buffer systems. But within this chemical buffer system, I'll talk about, I believe, 4 different specific ones. And the main goal of these buffer systems is to either bind to hydrogen ions or to prevent the dissociation of hydrogen ions. But if we also have alkaline conditions, we also would like to release hydrogen ions. So say it's getting too basic over here, which leads to death if it's over 8. We also need to have a buffer system that releases hydrogen ions into the ECF, into the plasma, so that we drift down back towards normal. So we're going to kind of talk about it in a two-way format, keeping it within this livable range of about 7.4. So here's just a blown-up picture of that sort of thing that I was laying out. So the more hydrogen ions, the more acidic it will be, the lower the pH. The higher the pH, the more hydroxide ions will be dissociated and the less hydrogen ions will be dissociated. And if we combine these two, obviously we make water, and water dissociates equally into both of these, which is why water is at a neutral 7 pH. But we want it to be within like 6.8 to 8 is livable, but these are a little more dangerous as you get higher or lower away from that 7.4 number. So the way a chemical buffer system works is it resists these big changes in pH, which we really don't have a big wiggle room here, 6.8 to 8. So we have to resist those changes. We have to keep it within that like 1.2 pH difference. And the way they do it is by binding or releasing hydrogen ions. So I use the bicarbonate and carbonic acid buffer for an example. So carbonic acid is right here, and it dissociates actively into hydrogen ions. So it's an acid, it's a weak acid, and bicarbonate, which is a negative ion. So when pH is high, so think about high, when I switch these around, so pH should be low here, which means a high hydrogen ion concentration. Equilibrium will favor the left side of the equation. So say we increase this sort of bucket here, the bucket will slowly equal out to equilibrium by giving more towards this left side. So hydrogen ions will be taken up to make carbonic acid again, so to buffer that out. Now when pH is high, once again crossing this out, which means there is a lower hydrogen ion concentration, equilibrium will favor the right side. So think about if we've got not much of this hydrogen ion, we'll probably have a more carbonic acid here, so then the range will gently shift to the right. So say we have a bigger jar right here and a smaller jar right here, it'll probably flow a little more towards the right. So it will release hydrogen ions, which will lower the pH. So I should switch those two words there. So this would be low, pH is low, high hydrogen ion, pH is high, low hydrogen ion. Now, this reaction will buffer all of the acids in the body, except for CO2-induced acidosis or just CO2 drop in pH. Buffers can't buffer themselves, and I'll show you that real quick. This is the lung buffer that I mentioned I wasn't going to talk too frequently about, but as you can see, when CO2 is super high, it will buffer into this carbonic acid with water. So carbon dioxide, water will equilibrate into H2CO3, which is carbonic acid. So if we have a lot more CO2, the bucket will shift over to the right, making more hydrogen ions, which is way over here, and bicarbonate ions. But since we can't directly buffer this CO2, we can't just when it goes over here, it can't flow back and forth and back and forth. So instead, we have to just reduce the amount of CO2 in the lungs. So if we have a big increase of CO2, we'd go right to here, remove it by the lungs, thereby decreasing hydrogen ion concentration. So that's another buffer. And I mentioned also earlier that the renal, the kidneys side, is controlling the HCO3 in this system, so the bicarbonate ion. So it will actively either reabsorb it or excrete it depending on the pH level in the plasma through the filtrate in the glomerulus. But we're not going to go into that. We're going to go back to the physical chemical buffer systems of the body. So besides the bicarbonate buffer system, which is the strongest one, probably the most known one amongst physiologists, the other one is the protein buffer system. This is also a hugely important buffer system, primarily in the ICF. So ICF stands for intracellular fluid buffer. And it also buffers the ECF, but primarily the intracellular, because we have a lot of proteins in our cells that are doing a bunch of work, and those proteins can include enzymes. So here's just an example of an amino acid of a protein with a nitrogenous base. When there is a low pH, so that we have a lot of hydrogen ions in the intracellular fluid, there will be hydrogen ions that add to this O group right here. So normally this O group would be slightly negative or even hold a negative charge, so we've got some free electrons floating around here. Hydrogen will associate with that group, that carbonyl group, and join to make a carboxyl group. Okay, so we're adding a hydrogen, so therefore the pH would rise. So it's kind of buffering this low pH to make a neutral pH. So if it's all good, about 7.4, we're happy right here. However, if there's not many hydrogen ions in the solution inside of the cell, luckily, what will happen is that we'll free up some of those hydrogen ions. So if we think about, we have this neutral pH, okay, now it's getting too high, so it's becoming too basic. This hydrogen will jump off of this oxygen and dissociate. So now this one's ionized, it's got a negative charge, but the hydrogen ions will be added to the solution, which will decrease the pH and increase the acidity, which is good so that we can get back to that neutral pH of about 7.4. There's also the hemoglobin buffer system, and this buffers against carbonic acid changes. So once again, I mentioned earlier that carbon dioxide changes can't directly buffer bicarbonate and carbonic acid because it's in the same system, so we have to use different systems. So in red blood cells, when they pick up the carbon dioxide from the tissue, so say you are exercising a lot and you have a lot more CO2 in your body, you'll bind that CO2 to your red blood cells, and that normally, if we go back, would elevate the amount of hydrogen ions. So we're exercise-induced CO2 increase, we increase hydrogen ions. Luckily, we've got the lungs to help out, but we also need, in that venous return, that blood that's coming back to the heart, we can't make that too acidic. So what the hemoglobin does, that protein on the blood that carries the oxygen and the CO2, it soaks up this extra hydrogen ions. So all of that, like CO2, is forming carbonic acid, it's dissociating into hydrogen ions, but luckily, carbonic anhydrase helps this hemoglobin soak up the hydrogen ions. So therefore, the blood plasma will not get too acidic. So in all effect, the venous blood only is slightly more acidic, maybe like 0.05 less pH than the systemic blood, which is miraculous. Without this ability, the blood would be super acidic, and it would probably wreak havoc on the body's systems just because that whole plasma would be incredibly acidic. So thank God for hemoglobin. And another one is the phosphate buffer system. This is less well known. So we've got this chemical here, sodium, I'm going to say sodium hydroxyphosphate or something along those lines. I actually don't know. So we're just going to call it Na2HPO4. So there's a sodium, hydrogen, and phosphate. Now, when this is added to a hydrogen ion, it will dissociate and kick off its sodium ion and gain the hydrogen ion. So if we think about this, how we've learned before, whenever there's too much hydrogen, so it's becoming too acidic, this sodium will kick off and the hydrogen will be taken up. So the pH will increase and the acidity will go down. But this isn't very abundant, this buffer. Although it's effective, there's just a very low concentration in the extracellular fluid. So the protein buffer will usually work the best. But this is commonly used as a urinary buffer. So if we think about in the kidneys, when in the tubular fluid, say we have a lot of hydrogen ions, we don't want the urine to become too acidic. So this buffers that out and dissociates with sodium, which can actually, if we think about back to the nephrons, will be reabsorbed or excreted depending on what it needs. So thanks for watching. I hope you enjoyed and I hope you learned something new.